NHA Phlebotomy Practice Test. Question 1. Which of the following is the first step in preparing a patient for venipuncture? Apply a tourniquet. Identify the patient. Select the venipuncture site. Disinfect the area. Question 2. What is the purpose of using a tourniquet during venipuncture? To disinfect the site. To locate the vein more easily. To prevent the patient from moving. To reduce pain during the procedure. Question 3. Which vein is most commonly used for venipuncture? Femoral vein. Great saphenous vein. Median cubital vein. Saphenous vein. Question 4. In what situation would capillary blood collection be preferred over venipuncture? In patients with difficult veins. For blood cultures. For large volume blood collection. In patients with hemophilia. Question 5. What is the maximum recommended depth for a capillary puncture on an adult's fingertip? 1.5 mm, 2.0 mm, 2.4 mm, 3.0 mm. Question 6. What is the correct order of draw for collecting blood samples using multiple tubes? Red, green, lavender. Light blue, red, green. Lavender, red, light blue. Green, light blue, lavender. Question 7. Which needle size is most commonly used for routine adult venipuncture? 16 gauge, 18 gauge, 21 gauge, 23 gauge. Question 8. What is the most common complication after venipuncture? Infection, hematoma, thrombosis, arteriospasm. Question 9. How long should pressure be applied to the venipuncture site after blood is drawn? 10 to 15 seconds. 30 to 60 seconds. 1 to 2 minutes. Until the bleeding stops. Question 10. Why is the first drop of blood wiped away during capillary blood collection? It contains more red blood cells. It contains tissue fluid. It has a lower glucose level. It contains more platelets. Question 11. Which antiseptic is most commonly used to clean the venipuncture site? Hydrogen peroxide, alcohol, betadine, chlorhexidine. Question 12. How many times should a blood collection tube be inverted after drawing blood? 2 to 3 times. 4 to 5 times. 8 to 10 times. 12 to 15 times. Question 13. What is the primary reason for rejecting a hemolyzed blood sample? Incorrect patient identification. Air contamination. Inaccurate test results. Excessive blood volume. Question 14. Which artery is most commonly used for arterial blood gas, ABG, collection? Brachial artery. Femoral artery. Radial artery. Dorsalis pedis artery. Question 15. Which of the following is a potential risk when performing a dermal puncture on an infant's heel? Hemolysis. Arteriospasm. Osteomyelitis. Petechiae. Question 16. What is the most appropriate action if a patient has a seizure during venipuncture? Restrain the patient. Remove the needle and protect the patient. Continue with the procedure. Call security. Question 17. What is the primary purpose of the modified Allen test? To check blood pressure. To assess collateral circulation. To detect anemia. To monitor glucose levels. Question 18. Which of the following is considered a pre-analytical error in blood collection? Incorrect labeling of the specimen. Improper test result interpretation. Incorrect diagnostic conclusion. Inaccurate transcription of the report. Question 19. What gauge needle is typically used for pediatric venipuncture? 16 gauge, 21 gauge, 23 gauge, 25 gauge. Question 20. How should a blood culture specimen be collected? Using an alcohol wipe only. Using a chlorhexidine or iodine solution. Using only a sterile needle and syringe. By performing a capillary collection. Question 21. What is the primary reason for using butterfly needles? To reduce the cost of blood collection. To access difficult or small veins. To collect large volumes of blood. To decrease the risk of hemolysis. Question 22. What is the first action a phlebotomist should take if a patient begins to feel faint during venipuncture? Remove the needle and lower the patient's head. Continue with the procedure. Have the patient stand up. Call for help immediately. Question 23. When drawing blood from a patient with an active 4 line, where should the blood be collected? Above the 4 site. Below the 4 site. From the same vein as the 4. From the hand on the same side as the 4. Question 24. Which of the following complications may arise if the tourniquet is left on for too long? Petechiae. Hemolysis. Hemoconcentration. All of the above. Question 25. Which of the following is a proper site for heel stick collection in a newborn? Center of the heel. Outer edge of the heel. The big toe. The calf.